Hello and namaste. As many of you know, I have been uploading videos on topics related to leadership and stress management on this channel. Mostly, they have been long format lectures that I use for my students. But starting today, I'm planning to make videos on a certain contemporary topics, things that catch my attention, and things where I believe I can add certain value to the conversation that is happening on that topic. So, the first topic that I would like to discuss is the current condition of the COVID pandemic in India. Just yesterday, I was speaking to a friend who had lost his wife just half an hour before I was speaking to him. So, of course, he was completely heartbroken. And earlier, a couple of months ago, I had lost a friend from my school days to COVID pandemic. So, deaths happening from COVID are a real thing. And people who have lost somebody who is a loved one or a very close person, they know the pain that comes from losing somebody. That said, I also think that there is a fear psychosis currently about the COVID pandemic, especially in the second wave that has taken over India. There is a huge fear pandemic. Again, today I was speaking to another friend who said that this is the first time that she is really fearful of this pandemic and how it will impact her. And similar statements actually have been made by a couple of my family members. And I have also seen similar statements being expressed by my friends on different WhatsApp groups that I'm part of. For the first time, they seem to be fearful of the conditions in India, and they are even fearful of their life. Now, what I would like to analyze in this video is how valid are those fears. I'm not a physician. As you know, I'm a doctor, not a physician doctor, but a doctor with a PhD degree. So I have a good understanding of data, of quantitative data, analyzing data. I also have a good understanding of psychology of people and the different ways that especially if you're talking about fear, different ways emotions get activated and the consequences of those emotions. So I have expertise in those areas. I'm not a physician, so that is something that I need to put forward explicitly. But let's try to analyze why is there so much of fear, and that it doesn't require a lot of intelligence to figure that out. There is a huge amount of fear psychosis that has been created primarily because of the way this pandemic has been covered by the media. And this is something that they do because negative news sells. So there's a huge profit motive here. Nothing sells like bad news. So they are not necessarily trying to get an accurate picture of what is happening on ground. Their objective is primarily to gain more viewership or more that more people read their newspaper or more people watch their television shows, or for that matter, their YouTube shows. So that is something that we need to understand. And there is also a group of people, some within the country and some outside the country, who are essentially enemies of India. They do not lose an opportunity to show India in bad light. If they can figure out ways of putting down India or the rich culture that we have, then they literally jump on those opportunities. And one can figure this out, especially with the way media has done the coverage of the cremation grounds in India. And this is especially in stark contrast to the way the same Western media covers death in the West. In fact, there are laws against how you take a photograph or the kind of coverage you do of funerals. You can be fined for thousands of dollars. You can even be imprisoned. Again, those laws vary by countries. But you are not allowed to be insensitive when you are covering any funeral. But the same media houses, the same people, have been explicitly showing this gory and ghastly photographs, drone shots of cremation grounds, where so many scores of funeral pyres have been burning. This, of course, is nothing unexpected. This is what we call as similar to what is called poverty porn. They try to show how poor India is or how horrible the conditions in India are. We see that in the media coverage. We also see that in popular movies, the Slumdog Millionaire effect, where they try to show the so-called third world countries in the baddest possible light. Even when the country makes some tremendous achievements in form of space research, again we know the kind of coverage that New York Times and many of the so-called respected newspapers have done, the kind of cartoons that they have published, literally belittling and making fun of India. So this is nothing unexpected. So there is a component of malice also that is associated. Although, as I said, it is not all malice. Sometimes it is just the profit motive. And sometimes it is a genuine belief that by showing these negative images, but we are creating a fear-based appeal, which probably then will lead people to take more precautions when they are interacting with people. So they will probably more likely to get themselves vaccinated or maintain social distancing or wear masks. So maybe there is also a small group that genuinely believes that this fear-based appeal will make a positive difference in the conditions of the country. But that's a question that actually I will probably cover in a bit, because that is irrational, that is not founded in research evidence that fear-based appeal works. Yes, it works, but in under very certain circumstances. Most of the time it backfires, but I will come to that point in a bit. So this kind of coverage that is shown about the huge number of deaths that are happening the scarcity of oxygen cylinders, and people are dying because they are not getting oxygen. And to a certain extent, there is truth to to these uh, to these deaths, to this scarcity of oxygen cylinders and the medications. Uh, so, in fact, it becomes a little difficult to criticize media because they are supposedly showing the truth. But the first thing that we need to take into account here, and this is something that I teach my students in many of my classes, negative news, any unpleasant news, uh, negative interactions between people, they are many times more powerful than positive interactions. In fact, you could see one of my videos on stress management in context of relationships, for example, where I talk about the research that has been done by John Gottman. Uh, so that's again, it is not just Gottman's research, but a whole long series of studies over decades that have been done that show that negative emotions are extremely powerful, many times more powerful than positive emotions. So, when we show these negative news, they tend to impact our psyche in a visceral and a much deeper way. Uh, and this is problematic because uh, for every one person that is dying, which, as I said in the beginning, is a big tragedy, especially for the family members, for the friends, right? It is a big tragedy. Even if one person dies, it is a huge tragedy. I was mentioning about my friend who lost his wife yesterday. You can imagine, you can just imagine the kind of sorrow, the kind of mental breakdown that he's going through. He has three kids, small kids. And you can imagine the pain that his kids would be going through. So even a single death is a huge tragedy. There is absolutely no denial about it. But for every one such death, there are 99 who are surviving, right? They survive fine, and they, in majority of the cases, probably 80% of the cases are really mild. They don't even need to be hospitalized. The 10% maybe that get serious, that where hospitalization needs to be done, again, majority recover fine and they go back to their homes, and they're fine. Within my immediate family and extended family, I have had many family members, both during the earlier wave and the current wave. I have had family members, I have had friends who friends and their families who got COVID, and many of them were elderly people too, and they recovered fine, thankfully, again, because as I said, in some families there have been deaths, but in my immediate and extended family there hasn't been a single death, although there was one case out of the 10 or so cases that we had in our family where the condition was extremely serious. And um, uh, so this is the case of my sister's mother-in-law, and she had to be hospitalized for a long time, and even after she recovered, she needed care for almost close to 2 months before she got back her energy. So there are some one or two such cases which become extremely severe, but for the majority of the cases, people recover absolutely fine, right? But why is it that we highlight only these negative cases, even when we intuitively know that negative is much more powerful than positive? So, in fact, what we should be doing, because negative is more powerful than positive, what do we suggest in psychology, in relationship management? That, for example, in case of relationships, in case of intimate relationships, or for that matter any kind of relationships, there should be 5 times the number of positive interactions that you have. Positive means pleasant, where you express good, positive things, positive emotions in your interactions, not just neutral interactions. 5 times the number of positive interactions for every one negative interaction. But what we see here is just the opposite. Even though the negative is just 1%, but that is what is occupying 99% of the conversation, which then is not surprising that it creates this fear psychosis amongst people. Now, some people may argue that it is not 1%, the number of actual deaths is many times more. In fact, there have been journalists, both from the West as well as in India, these vulture journalists who have written explicitly that the actual number of deaths are supposedly 10 times more than what is being reported. Now, what is the evidence behind those claims? Do they have any evidence? They don't. They haven't provided any evidence of the actual number of deaths being 10 times. Now, I can understand, you say that the actual number of deaths being maybe 1.5 times or 2 times. So instead of 1% people dying, maybe 2% people who are getting infected have died. Those things are possible. Again, that is not necessarily because of some because of governments trying to conspire and hide all that information, which may be happening maybe in some few cases. But you can imagine the kind of machinery that would be required in a democratic country, in a country where the press is so active, in a country where social media is so active, to try to hide all these number of deaths. So I'm not denying that underreporting of deaths is not the case. That is definitely the case. That has something that has happened even in the Western countries. But most of that underreporting happens because of imperfections in the system through which death reporting happens. Even so-called fully developed nations in the West have imperfect systems, and there have been cases even in the United States where huge amount of underreporting happened. Even with the change of regime from Trump to Biden, we saw some death numbers suddenly decreasing, especially with respect to the nurses and all, which doesn't make any statistical sense. Death rate shouldn't change dramatically just because of regime change. But that's a different discussion, political discussion, that I currently don't want to get into. The point is, yes, underreporting of deaths is probably the case, but it cannot be 10 times. And if that is the news that you emphasize over and over again, not only are you creating are bombarding people with this negative news of people dying and showing these gory pictures of cremation grounds. India has a death rate of, I'm forgetting, I think 7.3 people per thousand per year. So if we just do the calculations, let me actually do that calculation. So that will be 7.3 divided by 1,000, and we have so let's talk about Delhi. Delhi has a population about 20 million. So that gives, let's see, that gives a number of like close to 146,000 deaths happening every year in New Delhi again, every year. If we divide that by 365, let's see what's the number that we get here. We get 400 deaths per day in a city like Delhi. So obviously, even during regular times, we will see cremation grounds again, frankly, I don't know the number of cremation grounds that exist in Delhi, but let's say there are 10 cremation grounds. On any particular day, we may see about 40 funeral pyres. Uh, this is during normal circumstances. Again, right now there is an escalation in the number of deaths. So even during normal times, if you go and go to the funeral grounds, you will probably see multiple funeral pyres burning. Uh, so, but you and I don't have that context when we see multiple funeral pyres burning, and uh, it creates this psychosis that life is in danger, that everyone is dying, we are in this. Plus, in addition to that, the report comes that there is the actual number of deaths is probably 10 times what is being reported. So we start becoming even more fearful of the of our lives. So this is extremely problematic. There is a famous quote by the astronomer Carl Sagan, that extraordinary claims require extraordinary evidence. Worldwide, the death rate from COVID has been in the range of 1 to 2%. So if you are making a claim that the death rate in India is not that 1 to 2%, but 10%, 15%, if that's the kind of extraordinary claim that you're making, then you should also be providing extraordinary evidence in support of that. But no such thing is provided. And people, again, most people who do not have that scientific training in statistics, they are gullible, and they then start believing in these claims, which then creates even artificial scarcity of essential goods and of essential medicines, of oxygen in the system, which aggravates the problem even further. And those who are already in the hospital, even they get access to the news on their cell phones, right? You can imagine the kind of fear that they feel, and the morale of a person plays a huge role in how quickly you recover from any difficulties that you're having, be it health problems, be it personal problems, be it anything. I know this because I have had to deal with some major problems in my life over the past few years. And at one point of time, my morale had gone completely down, had taken a huge dip. That impacted my health, my productivity in the workplace, my life satisfaction, my everything. So I know the importance of that, having that positive morale in life. And what happens when that isn't there? We get depressed. We sense we get a sense of helplessness, hopelessness, which is not good. That's what enemies do for you. And again, even in my case, that was something that some unscrupulous people had. That's a separate topic that I won't cover right now. Maybe sometime in the future. But that's what even enemies do when you are trying to bring the morale of some country down. That's what you do. This is what is called psychological warfare. And knowingly or unknowingly, these media houses, that's what they are doing. Again, I don't know whether it is out of malice or out of incompetence, out of stupidity, but that's the effect that they are ultimately having on people, which is not good for the health of these people, even if they are trying to save lives. So this then brings I don't want to be talking too long. To the final point, this fear-based appeal, thinking that by creating this fear we can bring about positive changes in a society or in people, is a very misconceived way of thinking things. Have you tried, let's say, uh, have you succeeded in let's say getting your child become very diligent, become very develop some good great study habits by incorporating only fear in that person, in that kid? Oh, you will fail, or your future is going to be doomed. Again, I have seen parents doing that, but has it helped? It doesn't. What helps a kid get motivated to study hard is when the kid has what we call in the field of psychology, in the field of management, self-efficacy. When the child starts believing that yes, with effort he or she can achieve things, can improve his or her scores, can start doing better. That's what helps bring about positive change, not this fear psychosis. That doesn't help. Even it doesn't help, again, the studies that have been done on, let's say, smoking, on taking precautions, especially in context of the HIV. So there have been lots of studies that have been done on this particular topic. If it is a one-time shot, maybe yes, in some of those situations, this fear-based appeal helps. But in the long term, it doesn't. And here it is a long-term factor, is something that we have to take into account. People have to change their way of living. They always have to go put on masks and when they are going outside. And this habit formation doesn't happen as easily when you try to make these fear-based appeals. And especially for the people who are sick currently, they can get a sense of helplessness, hopelessness, that nothing's going to happen. There is such scarcity of oxygen that I'm probably going to die, and that can even worsen things further. So this fear-based appeal is often very counterproductive, even if the intentions are right, of why somebody may be creating these fear-based appeals. They often turn out to be very counterproductive. They don't help. What helps is, yeah, you can probably instill a little bit of fear, but then you have to give lot of positive hope that things are getting better, that the government is also taking lots of steps. And it is a fact that government is taking, government, and not just government, even private organizations and individuals, there's a lot of positive news, but those things aren't getting covered. People are distributing free food. People are giving access to, they're collaborating to help each other out. Government is gearing up the army, the navy, the Indian railways to transport oxygen to all the different areas on time. So a whole lot of thing is being done. Now, again, this does not mean that government is not to be blamed. Especially, I think the state governments in the country are to be blamed in a big way, because Prime Minister Modi had actually given funds, huge amounts of funds, to the state governments in December, January, to prepare these oxygen plants, anticipating the second wave. But many of these governments did absolutely nothing, these state governments, and health is a state subject. Again, I'm not trying to say that Modi or the central government is free from any blame either, because even like one of the basic principles of leadership is you not only give resources to your employees, but you also, and not only also give them a target, but also follow up with them. That's how you achieve results. So again, frankly, I don't have insider information about how much follow up did the federal government or the central government did with these state governments. If they didn't do sufficiently, then obviously even central government has to be blamed, partly for the severity of the conditions that exist currently. But ultimately, the point is, I think, yes, conditions are not necessarily very good right now, but things will get better in matter of few days, at the most couple of weeks. That's how things have been. Now, during this period, there will be few people who would lose their lives, and as I said again, for the loved ones of those people who lose their lives, it's it's going to be extremely painful. But majority people are recovering fine, and I have no reasons to believe that the actual number of deaths are humongously more than what is being officially reported. There is no evidence of that. And in fact, if that is the case, we will also know, because these deaths can't be hidden, right? Uh, uh, so we this data is not real time, so there is a time lag here, but maybe in a month or two or a year, when we have the death cause data, we will find out if there was a disproportionately higher number of deaths that were attributed to other causes, let's say heart attack or cancer and whatever. Then we can figure out that yes, data has been fudged, so there was a lot of underreporting. But again, that is at least based on what we have currently, whatever information we have currently. There is no reason to believe that things are horrible than what it is. And I think it is extremely important that we do cover the negative news, or even do discuss negative information, because that is also important to process the grief, to process the losses that we have had. I have personally spoken to friends who either have lost lives in their families, or are currently under quarantine, or going through infections. But it is also important to highlight the positive things. In majority of the cases, recovery happens, and I think there is no reason to live in this state of fear psychosis, because it hurts more than it helps. I'm sorry if I was not very coherent in what I was talking about. Probably I blabbered around a lot in the process. This is the first time I'm doing this. Plus, it's a emotional subject, no doubt about it. But hopefully this video inspires you to bring and share more positive news about this pandemic, and how we are actually succeeding, even if it is inch by inch, even if it is through very small steps, how we are ultimately succeeding over this big challenge that we have. I think that's what's going to increase our morale, our again, I didn't go into the biology of how our psychology impacts our physical health. That is something that I have covered in many of my lectures in stress management. But this positive mental state will have a much bigger, much significant positive impact on our lives. So I hope you all also take steps in your own small and big ways to share and to share such positive messages. Thank you. Namaste. Stay safe.